Anatomical directions are terms used to precisely describe the location of structures within the body relative to one another. These terms are essential for clear communication in anatomy and medicine. Anterior or ventral means towards the front of the body, posterior or dorsal refers to towards the back of the body, superior indicates towards the head or upper part of the body, inferior means towards the feet or lower part of the body, medial is towards the midline of the body, while lateral is away from the midline of the body. Proximal means closer to the origin or attachment point of a structure, and distal means farther from the origin or attachment point of a structure. Superficial means closer to the body surface, while deep indicates farther from the body surface. Opens in a new window, libretext.org, anatomical directional terms. Additional terms. Ipsilateral, on the same side of the body, contralateral on the opposite side of the body, supine, lying face up, prone, lying face down. To better grasp these terms, imagine a person standing upright with arms at their sides and palms facing forward. This is known as the anatomical position. The heart is anterior to the spine. The brain is superior to the heart. The little toe is lateral to the big toe. The elbow is proximal to the wrist. The skin is superficial to the muscles. Note, these terms are generally used consistently, but there can be some variations depending on the specific anatomical region being described.